please rise and put the flag. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome everyone, and brings our next item on the agenda, and that is for public comment. Public comment this morning.
Oh, okay. I guess I'll start. Hi, my name is Joe Duke, and I'm a advocate for mental health in Lebanon County, and I also am a member of the NAACP in NAMI. I'm a volunteer with NAMI, which is now also in Lebanon County, but it just hasn't gotten out yet because it's still in the works with Dauphin County. The two are being combined into one, and but there'll be separate pages and things for Lebanon County. The other thing I want to kind of talk about is in the recent past, because of all the support groups I'm involved with parents and substance abuse and so forth, I had a call from a mother from one of those groups, and her son was a graduate of Lebanon County Prison, and he spent many years in Lebanon County Prison, in and out, and eventually went to the state prison. And his crime was that he was a drug user. And the mother called me because the son tried to commit suicide, and she didn't know how to get services for him in this county. And I spoke with some people at Crisis. I won't go into the details too much of the person because there's HIPAA involved here, and they want privacy. But the person never got treatment for mental health, and that was his issue, not drugs. And I just want to say that that's why I'm here and being an advocate for others. And the one thing that I'm also very much into is, do we have any weaknesses anywhere, whether it's in the prison, in any of our systems, and have we addressed them, and have we at least put them down to say, this is something we got to do better with? I see that money's an issue right now. Have we put it down, and do we have a plan of how we're going forward to get more money? I'm just saying that that's what I'm looking at. I look at, in recovery, the first step is admitting that there's something that needs to be fixed. And that's also in the real world. And right now, we don't have the treatments and the things that are needed for mental health in Lebanon County. There's a lot of people doing a lot of good work and working on that. And I was in touch with 4 organizations to get this person's son help and to get him into a facility. And she was stonewalled at everyone that she had gone to. But I just want to say that that's what I'm looking at, and I will be presenting some things, and probably to the commissioners to look at, to talk about putting plans together to overcome some of these things that are problems. Because everybody seems to say, well, we just don't have money. I know, I don't have money either. So that's, I can have that for a lot of my problems, what I want to do. But going forward, there's a program in the state called Stepping Up, and it's a national program. And there are 36 counties in the state that are in that program. And Lebanon County is the 44th largest county in the state of Pennsylvania. And 16 of the counties that are smaller than us have that program, and all of them that are larger than us have that program. And the thing is, and that's all about saying, we have this problem, we have this problem, we have this problem, that we want to make it better. And to me, it's helping the people, it's helping the individuals. I'm concerned about, Joey that's in the prison, and that he gets the right treatment, and I'm not criticizing anybody, but we want to make sure he gets the right treatment in the right direction when he leaves there, so he can be rehabilitated. And as I said, I have a son that's in Housestadt prison who is getting mental health treatment and training, and when he comes out of there, he's going to have a job, have been trained in a trade, and is addressing his mental health issues. But I just want to say that, just so you know, and the other thing that I did this past weekend, I was in courses all week, and I got my certification for peer-to-peer mental health training in Lebanon for an army. And this morning I signed up for a 3-week class so I can get my peer-to-peer mental health training for certificate for the state of Pennsylvania. So I'm hoping to be around, and I'm hoping to be part of the team, and hoping to help all of us move this forward and help the people that aren't getting what they need when they need it. That's all I have. Thank you.
Thank you. Anyone else? Okay. If not, we'll move on to the next item, and that's the approval of the minutes from our meeting of June 19th. You presented a copy of those minutes.
Second, I do have a minor correction, or maybe just going forward, not necessarily for now, but in the first paragraph, it just mentions, Litz mentioned that CGL, and I just would like it to be designated either commissioner or warden for future, folks that might see it, so they can distinguish for sure with clarity, which is what.
Gotcha. Okay. And it should be commissioner. Oh no, it should be warden.
Yep.
Okay.
Perfect.
With that amendment to the minutes, any other questions or comments? If not, all in favor, please say aye.
Aye.
Any opposed? Let's have it. Let's have it. Thank you very much. Next item, Warden, the floor is yours.
Good morning. Just a few updates. CGL is not here, but they've been working feverishly. We've been dealing with many maintenance scenarios at the Lebanon County Correctional Facility. Like most people, they're dealing with the heat index and the volume that's putting on the machinery that's designated to help cool those systems. We had several systems in the administrative area go out, the work release area, mostly employee designated areas, and Sergeant Gibson from our detail department has been stepping above and beyond to help manifest the parts that are needed because of the time frame it would take until they would get mailed and delivered. So again, CGL has been dealing with a lot of the motor issues and compressor issues. It's just wear and tear, and it's preventive maintenance, and our unfortunate circumstances, it seems to all be happening at once. The struggle is finding the parts or the model numbers, and then it also comes at a cost because those motors and compressors are at a different cost than what they once were in the past. We did have some complaints about some areas over in our female unit. CGL noted on their report, I believe, that they investigated, there was a roof vent issue. They took care of that, so that helped impact a better shower scenario in the female unit. We have been getting complaints from the incarcerated population about water temps and such. CGL continues to address, take temperatures, and ensure that any adjustments in those areas need to be taken care of. They have done that. We're still at a standstill as far as the replacement of the heating units. I'm still waiting for more data regarding prevailing wage so we can get quotes, estimates, and get those ordered prior to hopefully what will be a winter season approaching. We began a security upgrade August 15th at the facility. That was part of the capital budget programs to help us get to where we need to be with some areas for security, noting that we have modified operations. So we're still doing visiting, we're still doing the bulk of our operations, but there has been a setback with sometimes maybe providing a rolling lockout for the incarcerated population. So again, with change or modifications to what the population is used to, it comes with some unhappiness. But we're doing the best we can because these security upgrades are much needed, and again, we're just adapting operations. We're giving as much as we can. We're pulling back minimally as we get through the security upgrades throughout the facility. July 15th, thank you. And lastly, again, we're continuing to try to hire. Like most agencies, we're at a vacancy rate that is causing a lot of mandatory overtime. And with that being said, we try and evaluate the type of advertisements that we're doing. The data that we're receiving tells us Indeed is the magic bullet, but again, you have to sort through those individuals because not all of them are adapt to work in a correctional institution. There's, the security clearances. There's actually the concept of what a correctional officer is from what they see on TV and what it actually is modern day and age. So we continue to get creative. We had a meeting with Prime Care this morning. We believe that we're going to co-join and try and do an on-site job fair in the near future. So those dates will be forthcoming. Other than that, we are open. We just did a new advertisement in what replaced the merchandiser. I believe it's called the advertiser. So you should see a new ad providing some different details to what rate of pay, etc. is for a correctional officer. Typically, we always went by dollar per hour. In reality, with just the job tasks, the operations, and where we are staffing, somebody could walk into a correctional officer and the starting rate might be an annual salary of $47,000. But when you factor in overtime and those kind of things, correctional officers right now could be potentially making up towards $90,000.
Wow.
And so when we're trying to draw out for people that are just getting out of college and going to the workforce, if they want to try and get their college debt paid off and get some trained experience, this is a great opportunity for them.
I'm not sure someone from HR or somebody would have to, or solicitor would have to chime in, but can you put the value of, we know the healthcare package for a family is about a little over $30,000. Individual is 20, that also is part of the package. Is there any way of enumerating that, so they can see this is a pretty, for somebody at an entry level position starting out at a jail, it's a good package. I don't know if that would help with it, but it's just another identifier as far as what that job is worth.
Great suggestion. We usually bulk it down to excellent benefits, excellent, but we never get into specifics, so I appreciate that suggestion.
If that's legal to do.
Also noted on our prison board is our numbers for June were up a little bit. Now this morning, like the average daily population for June was approximately 312. This morning it was down to 293. So again, it's continuing to ebb and flow. Also noted is, and I believe Tom or Mr. Weber from Prime Care will speak on it. We're still adjusting with our MAT numbers. Our MAT numbers have not decreased; they still are increased, and so we're paying special attention to all the legislation that is forthcoming and being presented to the facility to not only adapt cost-wise for what that looks like, but also operationally within the structure that we're provided to run such operation.
Warden, if I could ask you to back up your comments earlier about, the maintenance of our aging building. My observation, I'd love to hear your input. My observation 2 years ago when I was first appointed, we were still managing maintenance of the prison with our own resources internally, but because of staffing issues, we were down to one person. I recall, we signed this contract. It's more expensive, but it's my observation now, a year and a half, 2 years later, that we're in a much better position, that they're more, not that we didn't have good people, we just had lack of resources, much more resources, and really it sounds like we're doing much more preventive maintenance and we have a lot more expertise in a lot of areas that we didn't have. Is that a fair statement?
That is correct, and by vendoring maintenance, we were able to adapt to modern corrections and looking at the actual bones, like we have the bones, but just the wear and tear, they call it preventive maintenance. So there's a much more modernized way to track all the preventive maintenance that needs to be addressed and tackled. So you have somebody that's kind of working on that as we continue to adapt with just the malfunctions that are occurring rapidly almost on a daily basis. But again, not that our maintenance folks before were not doing what they were hired and paid to do. They were. It's just sometimes they were just at a disadvantage. The other part is each year that's another age that our materials, the manufacturer stuff is, it runs out of warranty or it becomes obsolete. And so CGL arriving in my professional opinion, the timing couldn't have been more perfect.
So, thus far, it's been a good investment. I know it cost us more to do that, but I think at the time we had a real liability.
Yeah, I mean, they're working, like it's every day it's a grind, and there's no such really sitting and downtime. Every day they are, there's feet to the ground, and there's really items that are being looked at and addressed. Now, if you note on the report, they are down a maintenance person. Like us, they continue to try and hire, run background checks, and find a suitable person to fit that third position. But again, business is booming in the maintenance world at the correctional facility.
Thank you. Anything else? Okay, we'll move on to the deputy warden departments.
I have nothing to add unless there's questions.
I have nothing to add.
I have nothing to add either.
Okay. Any other business come before the board? Would you like to offer anything?
Sure. Thank you for the opportunity. Just a couple of points. To address the concerns of mental health capabilities in the community as well as the correctional facility. As the commissioners are aware and the board is aware, I routinely report out at these meetings the status of our mental health patients in our facility. Again, by way of background, we identify every individual who comes into the facility as to their mental health stability or acuity using a rating scale developed with the DOC. It's a 4-point system, A, B, C, D. C's and D's are those experiencing mental health issues at this time. D's have serious mental illness. C's have been receiving care in the last 2 years. Those two categories represent, as of June, 69% of your prison population.
I think
So-
May and June were both the same.
Yeah, yeah.
Different mix, but
But
C and
they-
D's
yep,
equaling 60.
They did come out again at 63 Cs and 6Ds both months. As a result of that, we do have counselors and psychiatrists in the facility who see our patients. For June, we averaged approximately 25 visits of a mental health nature a day. Approximately 50% of the prison population is receiving psychotropic medications. For those patients that are presenting as a serious risk of imminent harm to themselves or others and require a level of care beyond what can be provided in a facility, we do have the ability to pursue inpatient treatment at Norristown State Hospital and Torrance State Hospital. Currently, we have 4 patients in the state hospital receiving care. Recognizing those hospital beds, I think, are limited to 35 for the state. We have over 10% coming from Lebanon, so there is a significant mental health acuity in this community. Just by way of background information, once we determine one of those individuals meets that high criteria of a serious risk of imminent harm to themselves or others, we have to petition the court in order to get an order to have them transferred to the state hospital. The last individual took approximately 42 days between the court order saying yes, they need to be out of jail and in a hospital setting, a secured hospital setting, but it still took 42 days. So there are certainly a lack of resources in the community as a whole to address this. But as I said, we are seeing individuals rather significantly, and the 25 visits a day don't count med passes, where there's also a quick assessment done when we're giving someone their psychotropic medications. So these individuals are being seen on a daily basis, as well as receiving education as to how they can seek additional help. Moving on, since the Warden mentioned it, the MAT, you may recall from the last meeting next week, the Department of Justice is holding a webinar to educate Pennsylvania counties on what they must do in terms of providing medicated assisted treatment in the facility. You'll recall 18 months ago, I approached you and indicated that this was coming. With the assistance of the warden, we worked out a plan so that we would have something in place rather than have it thrust upon us. The program has been steadily growing. We are up to 42 participants for the month of June. It is anticipated next week that the DOJ is going to indicate that they perceive that there is a requirement not only to maintain someone who comes into the facility already on a medicated assisted treatment program, but also induct someone or initiate the treatment for anyone who qualifies for this treatment. It is anticipated, I anticipate that assuming that induction or initiation is required, that our program will quickly double in size and quickly get to the 100 threshold. So as the warden indicated, again, like we did 18 months ago, trying to plan for this program, we started discussions already looking at where can we go in terms of where do you administer these medications. There are different forms of the medications. What is the cost benefit analysis of doing, say, a 1 month or one time a month shot versus 30 days of medication? Because the administration and the controlled diversion is a rather lengthy process if you're doing sublingual buprenorphine. So there are a lot of moving parts to it, a lot of demands, and we're also exploring where does the funding come for the, for these unfunded mandates at this point. Last thing I'd like to mention is our former HSA, our Health Service Administrator, on-site manager, Kevin, retired from Prime Care after 16 years of service. Fortunately, our Director of Nursing, Michelle, who has, we were able to promote within, has extensive experience in Lebanon County working with the jail. In fact, her spouse is one of the COs, so that she has a unique perspective of the operations of the facility from the medical and the correction standpoint. Historically, she's worked well with jail administration. I believe they are satisfied with the replacement. So we'll have some growing pains certainly, but we're pleased to be able to replace someone with that much tenure with someone else who has equal experience. Other than that, if you have any questions, I'd be happy to answer them.
I'm curious, I hadn't heard WellSpan Philhaven mentioned. Are they in the picture with your recovery at all?
No.
And how
There
about,
are once, we had of the 42 participants, we have 16 on methadone who were maintaining with their community, providing guest dosing. And when the individual is released, we make sure that there is a handoff back to that provider. And right now we're doing the same with the individuals who are coming in on buprenorphine. When we start doing inductions, we will impact us in working with corrections in terms of release planning. We'll have to bolster those outside resources to make sure we have a place for the individuals to go upon discharge.
I guess, I hear you say you're taking prisoners out of our county for like a state hospital. And is Philhaven more expensive, or are they not interested in housing our,
They won't take them.
they won't take them?
No.
So that's,
It needs to be, these are individuals oftentimes facing very serious violent charges. It needs to be a very secure setting. They remain technically within the custody of Lebanon County Prison. The state hospitals are run collectively with the DOC. They are secured psychiatric hospitals similar to what you might have envisioned from a movie in the early 70s. And that's where they house. They do have civil commitments as well, but all incarcerated individuals, unless the court's willing to drop charges, go to one of those state hospitals. So at times, depending upon the severity of the charges, we will work with the courts to see if we can have a discharge, but the courts themselves are often very, very concerned about whether you have mental health issues or not. Do you have a safe place to go to after you are released?
a home plan.
Yeah.
Thank you.
There's also an additional issue I can speak to on behalf of WellSpan, to some degree, that they have an issue too with just available beds. There's simply,
They're filled up.
often that is the case, that patients are sent as far away as Philadelphia.
Yeah, I just couldn't understand why they were all
Where we find
going.
the closest available dead. So
Yeah,
hard to-
that's a quasi judicial criminal justice arrangement in Pennsylvania, so, I mean, we have all of our facilities, the 36 that we represent, if they have an individual presenting in that capacity, go to one of those two facilities.
Yeah.
Yeah, I just want to say that, you know, when I was talking about in the beginning with, you know, stepping up and looking at the problems, what is happening in a lot of the counties across the country is they're looking for ways, the most expensive place to put somebody for mental health treatment is in the prison.
And one of the most inappropriate.
Yeah, and one of the most inappropriate, I agree. But, so they're looking, there's plans that are happening with, Joel and we were at the CIT program, for example. And there's a lot of, the counties are doing things to try to divert people who actually just need a mental health issue plan to go to somewhere else where they can be treated correctly for that. And I will try to gather some information and share some of those things.
If I could interrupt you, Mr. Duke, just to make you aware, I was just made aware yesterday, Jamie shared some information with you. In October, there's going to be a Pennsylvania Judicial Summit on Behavioral Health held in Hershey, and we were notified through the President Judge and asking all counties to participate in this so we can study best practices, have discussions, send a leadership group from each county, including President Judge and a representative and somebody from our office. I'm planning to go, probably the warden, probably, again, getting information on this. And I'm wondering, Tom, maybe we'll let you know if you would like to send a representative too. Again, I think the one, again, to study best practices and share information.
Yes, we'll be.
May I add something in addition? So the county, working with Holly Leahy from Mental Health and her representatives, they have a team called Team MISA, Mental Illness Substance Abuse. So I believe Chief Fortner from Adult Probation and Casey Felty from Mental Health, they went out and they tried to look at what best practices were being used across the Commonwealth. And Step Up, it's a great program. There's got to be a lot of buy-in from many stakeholders, many department heads across the broad, including judges, etc. When the county looked into that, what they were able to do was come up with, like, you know, baby steps, which is the TMISA, Mental Illness Substance Abuse. It is noted that we do a meeting once a month where, similar to Stepping Up, the people that are in the community that are involved with having some kind of mental health disorder and the people that are incarcerated, there's a group of stakeholders that have from community resources, community programming, county departments, where they try and triage. It could be as many as 5 to as many as 15 individuals to try and divert them out of the facility, whether it's at their preliminary hearing, depending if the district attorney will help work with their attorney for their charges. So it's just, again, Team MISA is a resource, and I don't know, Mr. Duke, if you ever reached out to Holly Leahy or took an interest. They do sometimes have community members involved in that program. Again, like you mentioned, like there is a lot of HIPAA, there's forms and such that need to be signed, but there is, you know, some efforts being done based off of the limited resources that the county has to help assist those in the community and to prevent them. I do know, like, if you talk to some of the law enforcement folks, they had some updated trainings along with the CISM SIP trainings, whereas now there's that extra step. Most cases where before they're criminally charged or brought to central booking or brought to the jail, they try and take them to the local hospital for crisis, so crisis can kind of help assist divert them all out so they're not coming to us. But unfortunately, the data that Prime Care shared, those numbers, sadly sometimes for that most vulnerable position those people are at, the only safe place they have is the jail. Again, not agreeing it's appropriate, but that's just the reality of the situation. But I just want you to know that Stepping Up was looked into. Again, if you touch base with Holly Leahy from Mental Health, maybe she can provide you a much broader education on Team MISA than what I'm able to do at this time.
Any Anything else for the good of the order?
I want to close with Tom. You know, we're spending about $250,000 a month that we've invested in prime care. And I can't think of a better way to spend that money, investing, you know, to get the best we can for the incarcerated folks while they're there for 21 days. It's very little time to be working with and have great outcomes. I mean, it's so, but those are the parts of the equation that, you know, somebody mentions, and I don't think it was meant disparagingly, that it's a money problem, but this is way beyond a money problem. Thank you.
Even if we had an extra $1 billion, it's a matter of resources as well, too. So it's a difficult challenge. Anyway, keep working at it. Anything else for the good of the order? Motion to adjourn?
Second.
We stand adjourned. Thank you all very
Thank
much.
you.